Hello, thank you for choosing Dignity Health St. John's Hospitals for your total joint replacement. My name is Elizabeth Galloway and I am a registered nurse here in the Surgical Services Department. In this video, I will review the total joint replacement process here at St. John's and share what you can expect before your surgery. Preparing for your surgery. Before your surgery, we will provide additional pre-operative education. We will also conduct a pre-operational interview to get to know you, assess your needs, and answer any surgery process questions. Additionally, you may need to come to the hospital prior to your surgery for pre-registration and pre-operative testing. We request that you enter through the main hospital entrance for pre-registration, pre-operative testing, and on the day of your surgery. Before your surgery, we recommend that you prepare at home. Some of the steps you can take are: select a support person. It's often difficult to take in all the details that help prepare you for both the actual surgery and your post-operative recovery. Having a support person can ensure that someone else is also listening in, taking notes, and learning about the steps that can be taken to ensure a smooth recovery. Your support person will also be designated to drive you home on the day of discharge and assist you through your home recovery. Be sure to remove household items from the floor, such as rugs, clutter, that may cause you to trip and fall. Place frequently used items at the height that is easily accessible to you. Make sure to stock up on groceries ahead of time. If you do not have someone at home to cook for you, select items that are easy to reheat and quick to prepare yourself. Try to plan for a balanced diet with plenty of protein, fruits, and vegetables to promote healing. Allow yourself time to fill all your prescriptions ahead of time, including home pain medications. Please confirm the current hospital visitation policy and share it with your loved ones. Prior to your surgery, our surgery pre-operative nurse will review and discuss all daily medications, including which medications need to be taken the morning of surgery. You will need to stop taking all herbal medications and vitamins 7 days prior to surgery and discontinue blood thinners as directed by your physician. You may receive a surgery prep kit. This kit contains chlorhexidine antiseptic soap, which needs to be used at home the night before and the morning of surgery to help prevent infection. Remember, no food or drink, including water, should be consumed after midnight before the day of surgery unless your physician approves it. Eating and drinking will interfere with your anesthesia and put your surgery at risk for cancellation. The day of surgery. On the day of your surgery, make sure to bring the following items with you to the hospital: your insurance card and photo ID, a copy of your advance directive if you have one, personal hygiene items such as hairbrush, toothbrush, lotion, and lip balm, a pair of comfortable walking shoes, a change of clothes that is loose-fitting and comfortable for going home. We will provide you with a traditional walker on the day of your discharge. If you have a traditional walker, please bring it the day of your surgery. Personal walkers need to be approved by our nurse. Walkers with seats are not permitted. Do not bring valuables such as jewelry, a watch, credit cards, and/or cash. On the day of surgery, it is important that you arrive on time. Please check in at the front desk where you will be directed to the admission office, which is located near the main lobby. Our admitting staff will verify your identity, contact information, and insurance. They will also collect a copay if indicated and provide you with additional information regarding your admission to the hospital. Once the admission process is complete, you will be guided to the surgery waiting room. A surgery nurse will arrive shortly to start the pre-operative process. Once you are in the pre-operative area, you will review and sign your operative consent form for surgery. We will provide you with a patient gown and socks, take your vital signs, and start your IV, which is how we deliver fluids and medications into the bloodstream. Afterwards, you will meet your anesthesiologist, who will review your medical history and discuss the type of anesthesia that will be used for your surgery. You will also meet your operative room OR nurse, who will review your chart and confirm that you are fully prepped for surgery. Your surgeon will visit you and answer any last-minute questions you may have. The surgeon will also mark your extremity with a surgical pen to indicate the correct surgical site prior to entering the OR. If your surgeon orders a urinary catheter, it will be inserted while you are under anesthesia. The surgeon will typically order it to be removed the day after surgery to reduce the risk of a catheter-associated urinary tract infection. After surgery. Once your surgery is complete, you will be taken to the PACU, Post-Anesthesia Care Unit Recovery Room, where you will be cared for by our PACU team. Our PACU nurses are highly trained to specifically care for post-surgery patients. Please be mindful that after you wake up from surgery, you may experience any of the following anesthesia side effects: grogginess, nausea, and itching. Please let your nurse know if you have any of these side effects or if you're in any pain so we can care for you appropriately. You will remain in the PACU unit until you're fully awake, your pain is controlled, and your vital signs are stable. This can take approximately 45 to 90 minutes. If you are admitted to our hospital for 1 or more nights, we will transfer you up to a patient care room once you are stable. During your stay, your medical surgical nurse will receive a detailed report from your PACU nurse. The nurse will orient you to your new room, and you will be provided with a call light to communicate with your care team. Your nurse will begin to progress your diet slowly, starting you with ice chips and liquids. If you eat solid foods too soon, you may become nauseous due to anesthesia. If you need to use the restroom, a nurse will assist you as needed. Due to surgery, anesthesia, and pain medications, you are considered at an increased risk for falls and injury. Please do not get out of your bed, chair, or perform any transfers on your own. Please press your call light for help. Be mindful to always wear our proper footwear, such as our non-skid socks or shoes when you are out of bed. After surgery, it is important that we properly manage your pain. You will be asked to rate your pain on a scale of 0 to 10, 0 being no pain and 10 being the worst pain. To best manage your pain, please inform your nurse when you are experiencing any pain. Other non-pharmaceutical measures for pain management include shifting your body position, performing relaxation and deep breathing exercises, and using ice cold packs. If your pain is not being controlled by the medications ordered, please notify your nurse so they can communicate this information to your surgeon and develop a new plan of pain management. Breathing exercises. During your stay, you will be requested to do breathing exercises with your incentive spirometer breathing exerciser device to open your lungs and deliver oxygen to all the areas of the body and promote healing. The spirometer should be used at least 10 times every hour while you are awake. With surgery, patients are at increased risk for shallow breathing. This exercise will also help prevent pneumonia, which can occur from the collection of mucus at the base of your lungs. Continue to use your spirometer for a week or so after you go home. Blood clot prevention. To prevent blood clots, your doctor may want you to wear a sequential compression device to promote circulation. You will also be given a blood thinner after surgery to help prevent any blood clot formation. Positioning. We recommend to shift your weight in bed and reposition at least every 2 hours. If you have had a hip surgery that requires an abductor pillow, a wedge-shaped pillow that is placed between your knees, the pillow will be utilized while turning you. Our staff will assist you as needed. Frequent repositioning will help circulation and prevent sore spots. Therapy services. On the day of your surgery, your surgeon will request a physical therapy and an occupational therapy assessment. These assessments will be completed on the day of surgery or the following morning. On day 1, our therapists will evaluate with you the following: your prior level of function and equipment that you use currently or have used in the past. They will assess your current mobility and initiate your training on bed mobility, as well as teaching you how to transfer your position into sitting and standing with progression into walking on your own. Our therapists will initiate an exercise program focused on swelling reduction, range of motion, and strengthening of your affected limb. Training on activities of daily living, ADL performance, will commence, including dressing, toileting, and progression into bathing. They will also provide education on surgical precautions and safety during mobility. On day 2 through the day of your discharge, you will continue to work on all of these factors with your therapist twice daily. Our therapists will also assess the type of equipment needed to assist you with completion of ADLs and safe mobility. Discharge process. During your stay with us, your surgeon will check in on you to discuss your progress and the next steps in your care. Joint replacement surgeries vary in hospital length of stay. Your surgeon will discharge you when it is appropriate. Some patients may be discharged the same day of surgery, others may stay 1 or more nights. Once discharge orders have been submitted, our team will review with you all your discharge instructions, including medication education. Please ask for clarification if there is anything that is unclear. Your case manager will work with you and your support person to ensure that you are equipped to go home. Your case manager will assist with acquiring the necessary equipment, such as a walker, and will also help you set up a home health agency for home physical therapy if your physician has requested this. You are responsible for scheduling a follow-up appointment with your surgeon as indicated on the discharge paperwork. Any post-operative concerns should be addressed with your surgeon. Thank you for choosing Dignity Health St. John's for your total joint replacement journey. For more information, please call our surgery prep team at St. John's Hospital Camarillo, 805-389-5607. Thank you.